Well, this fall has been a busy season for doctors, not only dealing with COVID and the flu cases, but they're also seeing an uptick in cases of respiratory syncytial virus known as RSV. WMRT News' Nordea Lewis tells us more.
Hospital beds in Maryland are being flooded by a wave of young children with respiratory infections. The uptick of RSV patients have filled the hospital beds, forcing many sick children to wait in emergency rooms for hours or be moved to another hospital out of state.
RSV, which is a respiratory syncytial virus, is a virus that's very well contagious, spread through the air, and tends to have a seasonality to it. And this is it. This is the time of year where we tend to see a lot of those cases, both in the patients that I care for who are on the adult side, as well as especially on the pediatric side.
The symptoms include runny nose, fever, and shortness of breath. Many parents can mistake these symptoms for just a common cold, but doctors say that's what put kids and some adults in bad shape. If RSV is not treated adequately, it leads to a bigger risk.
You know your parental instinct. You know if your child is not improving. If that crosses that threshold, whatever that should be, call your pediatrician and start implementing your action plan of where to take your child. And same thing for the adults out there. Again, I don't want RSV to be seen as just a child's disease. Plenty of my patients with COPD and asthma get it and suffer dire consequences. You know your body better than any doctor. RSV can be fatal in vulnerable populations.
Governor Hogan allocated $25 million in state funding to prioritize pediatric ICU staffing. But with doctors battling what many call a triple-demic involving COVID, influenza, and RSV, it may not be enough, which is why they asked Marylanders to do their part.
If we as doctors are telling you there is a wave, a storm of viral infections coming, grab that face mask. Protect yourself as much as possible, yourself and your children.
In Baltimore, Nordea Lewis, WMAR 2 News.